The air crackled with anticipation at the annual dermatology conference. Hundreds of specialists gathered, eager to discuss the latest advancements in their field. Among the crowd, one topic dominated the hushed conversations: Botox. This revolutionary neurotoxin has taken the world by storm, rapidly becoming a staple in both aesthetic and therapeutic practices. Its ability to temporarily paralyze muscles has led to groundbreaking applications, captivating both practitioners and patients alike. Botox represents a remarkable intersection of science, medicine, and artistry. Its applications extend far beyond cosmetic enhancements, offering promising solutions for a variety of medical conditions. From smoothing wrinkles to treating migraines, Botox has revolutionized the way we approach facial rejuvenation and therapeutic interventions. This essay delves into the fascinating world of Botox, exploring its scientific underpinnings, clinical uses, and future potential. Botox, short for botulinum toxin, is a neurotoxic protein produced by the bacterium Clostridium botulinum. It works by blocking the release of acetylcholine, a neurotransmitter responsible for muscle contractions. By inhibiting this chemical messenger, Botox effectively paralyzes the targeted muscles, leading to a reduction in wrinkles, muscle spasms, and various other conditions. The history of Botox dates back to the 19th century, with its paralytic effects first observed in food poisoning cases. However, it wasn't until the 1970s that scientists began exploring its therapeutic potential. Dr. Alan Scott, an ophthalmologist, pioneered the use of Botox for treating strabismus, a condition causing misaligned eyes. This groundbreaking discovery paved the way for further research and the eventual approval of Botox for cosmetic use in 2002. While the term Botox is often used generically, it's important to note that several types of botulinum toxin exist. Each type, A, B, C, and so on, targets different subtypes of acetylcholine receptors, resulting in varying potencies and durations of effect. Commercially available botulinum toxin products come in different formulations and concentrations, each tailored for specific applications. Understanding the nuances between these formulations is crucial for practitioners. Factors like diffusion radius, onset of action, and longevity of effect can significantly influence treatment outcomes. For instance, Botox Cosmetic, specifically designed for cosmetic use, differs in concentration and formulation from Botox Therapeutic, used for treating medical conditions like migraines and muscle spasticity. Section 4, Botox in Action, a Clinical Perspective. The clinical applications of Botox are remarkably diverse, spanning both aesthetic and therapeutic realms. In aesthetics, Botox reigns supreme in treating dynamic wrinkles, those etched by repeated muscle contractions. Frown lines, crow's feet, and forehead furrows are effectively softened, resulting in a smoother and more youthful appearance. Beyond aesthetics, Botox has become an invaluable tool for managing a wide array of medical conditions. It offers relief from chronic migraines, excessive sweating, also known as hyperhidrosis, and overactive bladder. Botox injections can also alleviate muscle spasticity associated with conditions like cerebral palsy, reducing pain and improving mobility. This expanding therapeutic repertoire highlights the remarkable versatility of this neurotoxin.